Let's talk meniscuses. So knees, these bits here aren't blue in real life, but meniscuses go wrong in our knee joint. And what they do is they make two odd bits of bone fit together with a gristly bit in the middle of it. And that means that they basically make them sort of sit neatly together. And they often get irritated when the knee joint is buckling at funny forces and funny angles. Classically, I was walking in the golf club a couple of months ago, and I was walking at a funny angle, and my leg slipped and went whoop, and that torsional force just irritated the meniscus, and they can take quite a long time to heal. The reason being is because they don't actually have their own blood supply, so they sit in a wash of their own synovial fluid, a liquid, and that liquid then gives them energy, so it doesn't have its own blood supply, so it heals very slowly. If the tear is very large, it might not heal at all, and those need surgery. But the ones that are slightly smaller and slightly irritated, and you can get a nip on the outside of the angle there where it nips, those can then heal up. And what's the most important thing about having a meniscal problem and getting it right is that we understand how the knee joint works. So the outside of the knee is for mobility. So this gap here is slightly bigger and this area here is slightly smaller. So when you start to move it, often you'll see when it's not in the right places, the medial side starts to gap more, so it becomes more unstable, and the inside, the lateral part of the knee starts to get closed up, and of course that makes this meniscus work in a poor alignment, and then the meniscus is more likely to get nipped and irritated. So what we do as an osteopath is we take some tension out the outside of the leg, of the quadricep, the vastus lateralis muscle, and sometimes the perineal muscle that comes up, this whole chain of muscles, to open up this joint so it's wider, so the meniscus is under less pressure and the alignment improves. Once that settles down, what we do is we then strengthen this part of the muscle here, inside of the knee joint, the teardrop muscle called the vastus medialis, the VMO. And if you strengthen that, that gives stability to the knee joint, and that stabilises the joint itself. So meniscuses sometimes need operations, most of the time they don't. It's really important to get the alignment right. If you get the alignment right, the area can heal properly. The sort of things you can do when you're irritated is when you're often sliding on funny angles, misstepping yourself, often twisting, say maybe in the kitchen or a bathroom, when you turn on it you can feel a little twinge. Those are warning signs that the meniscus is moaning. Sometimes like crouching, you can feel it getting a lot of pressure in the knee itself. Again, that might be meniscus, or if you're a bit older, it can be osteoarthritis. So those are meniscus problems. Had one recently myself. It is greatly improved, but you have to be very careful to manage it right. Hope that helps, guys. Take care, and we'll see you in the clinic. If you have a meniscus problem or anything else, give us a call. Bye bye.